Good morning, everyone, and welcome. I'm Sarah Cott, Senior Vice President of Programming at The Hill. Thank you all for joining us in person this morning, and thank you to everyone joining us online as well. Our event today is Science and Policy, the Future of Cancer Care, and I'd like to thank our sponsors, AstraZeneca, for their support of this discussion. The American Cancer Society recently shared a bleak figure. For the first time, the annual number of new cases of cancer in the United States is expected to cross the 2 million mark. While advancements in cancer have led to a steady decline in cancer deaths over the last 30 years, rising cases for many common cancers put that progress at risk. More than 313,000 new breast cancer cases are projected for 2024 alone. How can the federal government, healthcare providers, patients, and other stakeholders working together to promote innovation for cancer prevention and treatment? How should we address inequities when it comes to screening, diagnostics, and cancer care? And how can we reverse the trends of rising cancer incidence in the United States? Now, before we get underway, for everyone in the room, a few housekeeping notes. If you could please turn your phones on silent, that would be greatly appreciated. Thank you. And if you're joining us online, please, you are welcome to join the conversation via social media. You can follow us on Facebook, Instagram, and at the Hill events using the hashtag HillHealth. And then one more note for those of you in the room, you will notice that one of your flyers, the URL at the bottom of it is cut off. We had a little printing error this morning. The URL is saveraretreatments.org. And with that, I'm delighted to welcome Bob Cusack, the Hill's editor-in-chief, to the stage. He will be moderating a special bipartisan interview with Congressman John Joyce and Wiley, co-sponsors of the Orphan Cures Act.
Hey, Congressman, thanks for
Good morning.
Want to start with some news of the day. Interesting day in the House yesterday. Speaking of bipartisan, there was a bipartisan vote to basically shelve the motion to vacate. What did you think of that? What was the mood of the House yesterday on that bipartisan vote?
I think there was a clarity that members on both sides of the aisle support Speaker Mike Johnson and want to stay at work and get back to work.
Congressman, your views?
Yeah, I think this was a great message for bipartisan governance. Showing that people here in the House want to get things done, and there's a bipartisan coalition that supports doing the work of the American people, and I think that's a good thing.
Speaking of bipartisanship, tell us about your connection, how you guys work together on legislation that we'll talk about in depth.
Well, two pieces of legislation that Representative Nickel and I work on, the Orphan Cures Act and the Mini Act, address orphan drugs and specifically address orphan diseases. And to be able to collaborate across the aisle, if there's a message that I think resonates with everyone, the cancer doesn't care what your affiliation is. It doesn't care if you're an independent, a Republican, or a Democrat. And to be able to collaborate and address that in a bipartisan manner will allow both of these pieces of legislation to be successful.
Yeah, and in this Congress, if you were going to get anything done, you've got to have bipartisan support. Republicans have a majority in the House, Democrats have a majority in the Senate. We've got the White House, so you have to work together if you want to get anything done. And that's been what's really rewarding about this issue. This is a place where we're continuing to build bipartisan support, and making sure we educate people and get that message out, I think, is really important to the success of it.
What is the path, Congressman Joyce, of the Orphan Cures Act? As I mentioned, it's bipartisan, similar, same amount of Republicans as Democrats or co-sponsors. Looked it up last night. Are you looking to attach this? Have you taught? This has been referred to both Ways and Means and Energy and Healthcare, Energy and Commerce, which is normal for healthcare bills. Can you get this done this year?
That is, I'm an optimist, and I feel that this is so important that the Orphan Cures Act crosses the finish line, whether it's attached to a larger piece of legislation or stands independently. My goal is to see it to be successful. I'd like to set the table for everyone who's listening, who's watching, and who's present here today. This is a piece of legislation that broadens the use of drugs that affect many rare diseases. So we have to define what a rare disease is. A rare disease is a disease that affects 200,000 or fewer Americans. And rare diseases perhaps is a bit of a misnomer, because rare diseases are diseases that we all recognize, like sickle cell disease, like all childhood cancers, like diseases like Duchenne's muscular dystrophy. So maybe rare diseases aren't that rare, that we all know someone who's had a family member or themselves who have had a rare disease, and to be able to attach legislation that has multiple orphan drugs that can be effective against these rare diseases. And so this is a piece of legislation that I think, again, can develop continued bipartisan support and cross the finish line.
No, and I think agree 100%. I think there's a number of larger bills where, as part of the horse trading between the White House, House, and Senate, this is something that should get some attention. And the Inflation Reduction Act was done very hastily. There wasn't, a lot of focus on how, the work they did in the last Congress could disincentivize the research into these rare diseases. So, we're seeing this as just one of the tweaks, tune-ups to the Inflation Reduction Act to help it continue to move forward in a way that's helpful for everyone.
Is that going to be difficult, though, for passage because the Inflation Reduction Act was obviously a partisan bill supported by Democrats but not Republicans, and this is certainly tweaking that legislation, which of course, that law now that the White House is very proud of.
When we do major legislation, we continue to refine it, and I think that's our job in Congress, is to litigate these issues, to have a very robust discussion about how we can improve the Inflation Reduction Act, and I think this is something that, if you care about rare diseases, if you care about fighting cancer, this will help in a very major way.
And what it does is, as we're developing this, we're having bipartisan support. We're moving this forward with Democrats and Republicans sitting down, having these discussions, and signing on to this legislation.
What do you see as a potential vehicle, and do you think it's perhaps more likely after the election in the lame duck session, when sometimes a lot gets done?
I think that whatever the pathway to success is, we're willing to embrace that. Certainly if it occurs during the lame duck session, that would be acceptable as well. Again, we want to see this cross the finish line.
And just to your earlier point about the chaos and confusion we've seen in the House, I think what we saw yesterday with a bipartisan group of legislators, saying we want to move forward is really good for getting legislation done. The last time we did this, we basically lost a month of work in the House, and now we get to focus on, moving legislation forward instead of the standstill that we had the last time this happened.
Congressman, you're a dermatologist, part of the Doctors Caucus. What do you advise people on? We'll talk a lot this morning. There's a lot of work to do on cancer, but we've made a lot of progress. Skin cancer, though, is certainly very prevalent.
Skin cancer in May is Skin Cancer Awareness Month.
Yep.
I would be amiss if I didn't encourage everyone. When we talk about the rising number of cancer cases, protect yourself. Wear your hat, wear your sunglasses, wear a sunscreen of SPF 30 or higher, even on cloudy days between 10 and 4. My grandfather died of skin cancer. I never had the opportunity to meet him. And it was one of the reasons why I became a physician. It's one of the reasons why I became a dermatologist. Skin cancers, when caught early, are some of the most treatable cancers that we have in the United States. We have great opportunities to do that. When I started practicing dermatology, and as recently as before I came to Congress, I practiced derm for 25 years. I practiced with a great partner, my wife, and who continues to practice. I talked to her this morning as she was heading into work, and I was heading into this discussion with you. But 5 years ago, metastatic melanoma was often a death sentence. We knew that. I would see a patient, see a suspicious lesion, excise that, send it for biopsy, palpate for nodes, and if there were nodes, I would send them for a sentinel lymph node biopsy. If those were positive, if it showed that it had already spread from the initial lesion, they were sent for a medical and a surgical evaluation as well. But often, because there were not effective treatments, they were quickly sent to hospice care. But we saw immunotherapies, we saw innovation, which is one of the cornerstones of American medicine. We saw that continue to develop. So now diseases like metastatic melanoma are curable with the treatments that have developed since I came to Congress. Not because of what I did in Congress, but because of the innovation and research that industry continues to do. And those immunotherapies that treat successfully, like President Jimmy Carter, who had metastatic melanoma to the brain, and had that cured because of those immunotherapies. Those immunotherapies then were found to be successful for treating other types of diseases, like squamous cell carcinoma of the lung, another common cancer that we see in the United States. So that multiple drug exemptions, what we're looking for with the Orphan Drug Act is that we remove those drugs that are successful for treating multiple diseases, we remove those from the Medicare price negotiations so that we can continue to see that innovation extend into other arenas. We want to see that innovation, we want to see that investment occur in research and development, and the only way that we can see that being successful is with a minor modification, a minor tweak, if you will, to the IRA.
Congressman Nickel, as far as the Cancer Moonshot Initiative, there's been some frustration from the administration about funding that. And when you look at our rising debt and the future of Medicare, which is not bright, and at some point Congress is going to have to get involved, where are the funding choices going to have to be? Because obviously this is a bipartisan issue, but the debt keeps going higher and higher.
No, we have to do a lot of things at once in Congress. But you get to make your priorities, and I think that's especially important. I'm someone who lost my father to cancer, so this is a huge priority to me. And we have the resources to do it. We need to make those investments, and when we're talking about the Cancer Moonshot, we have the ability to do it, and we just need a continued push and to educate people. That's really the main issue, and what I hope folks here to take to heart is you have an amazing opportunity to educate members of Congress on issues, and if you educate folks on your issues, you're going to be successful here in Washington.
Oh, a question for both of you, Congressman Joyce, first to you. What do you hear back home on healthcare nowadays?
I think that the number one thing that I hear is access to health care. I represent South Central Pennsylvania, a rural area, and if there's one positive thing that came out of COVID, it is telemedicine. And extending the access to telemedicine, I work on communications and technology. So as we see the BEADS fund rolling out and expanding the capabilities to have internet connections within my district, that allows those individuals who don't have that access right now to be able to be connected with a specialist, whether that specialist is in Philadelphia or Pittsburgh, because my district is right in the middle. I want to be able to see that my patients, my constituents, have that ability to connectivity to allow them to have the innovation that allows them to see a specialist much more rapidly without having to travel hours to sit in the waiting room and do that. It's a great opportunity. Patients want that access. Patients want that innovation.
In your district, has broadband really increased the accessibility since COVID?
Without a doubt. I think individuals want that. Once they were able to see how successful that was, they want to be able to have that access. And it occurs specifically in telemedicine.
Congressman, same question to you.
Yeah, I represent a mixture of urban, suburban, and rural. And in the rural parts of my district, access to care is a huge issue. We need to certainly do a lot more. Great strides in the last few years on access to broadband. But in North Carolina, the big issue for us is Medicaid expansion. Finally, after 10 years, we were able to expand Medicaid, and that's a real game changer for rural North Carolina, which is something that we spend a lot of time working on and talking about.
What about the quality of care in districts? You mentioned because healthcare in the United States isn't fair. We have rural, urban issues. We've got a lot of doctors will go to cities. Have you seen improvements there, and anything policymakers can do there?
I'll take that first, because as I ran for office, my district is large. It's 12 counties from Gettysburg out to Somerset counties in South Central and Southwestern Pennsylvania. I ran in a very crowded primary the first time, and I would sit down with folks, and they reached out to hospitals, to pharmacists, to different boards, and say, "You seem like a good guy. It seems like healthcare is your major influence. Probably unlikely you're going to win, but when you're done, here's an application to our hospital." And I left that primary with 12 applications to different hospital facilities. So the first meeting, when we sat down in the office and with my legislative director, Matt Tucker, we developed a plan to bring medical students back to the rural district. Look, I trained in Philadelphia. I trained at Hopkins in Baltimore. I trained at major metropolitan areas. But the ability to return to rural areas is often challenged. Individuals stay typically where they've trained. And so to be able to incentivize students to return to the rural areas, we developed a homegrown healthcare initiative with one of the medical schools in Pennsylvania to allow students to rotate the entirety of their third and fourth year in the rural settings. So we connected with hospitals, we connected with community health centers, and allowed the students to come and rotate there. We involved a Veterans Administration hospital, a VA hospital, to have students there, to have their first exposures. This is not a catch and release program, it's a catch and keep program. And so students develop mentorships. They often return to the homes where they were born, where they have family members that work in these hospitals. First year was 12 students. Second year was 24. Third year was 48. We now have students in residency programs that are committed to stay in these rural areas. And this is predominantly in primary care. This is those individuals who want to be family doctors, who want to be pediatricians and emergency room doctors. If you want to be the next Ben Carson and be a pediatric neurosurgeon, this might not be the best program for you. But if your emphasis is to take care of the individuals in a primary care setting, it's a great opportunity to come home. And we have shown this to be successful. And we have shown this with zero tax dollars being put into these programs. It's sitting down, talking to the hospitals, talking about providing housing for the students, providing meals for the students, and allowing them to come home to central Pennsylvania.
You know, we need to do a lot more for healthcare. For me, I look at it in terms of, you know, rural America. For most parts of rural America, your largest employer is going to be your hospital. In Congress, though, my frustration as a freshman is the amount of different committees that have pieces of this equation. I serve on the House Financial Services Committee, which has some pretty good, pretty good lane where, we've got banking, housing, and Wall Street, so we can really focus on those issues. But one of my hopes as a freshman is we can change how the committees work to just have one health committee where you can get members, like Congressman Joyce, who just focus on everything that touches healthcare in the same committee and really develop that policy expertise.
Along those lines, how do you overcome the bureaucracy of not only Congress, which, as you mentioned, there are a lot of committees that have, I know, I used to cover healthcare, so Energy and Commerce and Ways and Means have a bit of a rivalry. But how do you get over that? And then you have so many government agencies that have their hands in healthcare.
I think you have to embrace that. I think that's the system, and to be able to work in a very calculated method of how you allow each of them to interface to what works the best for your constituents. It's an arduous process. It's not easily achieved. And developing the connections with your fellow colleagues, to be able to work with someone like Representative Nickel, who represents really the research triangle, which is so important to allowing the innovation to continue to occur. When I go home, I talk about his work. I talk about being able to collaborate across the aisle and how important that is for success. But you have to also be able to work within a Veterans Administration hospital that had never seen medical students rotate there. And when we first had our first meeting, it was like we walked out and they said this was unachievable. But the second and the third bite at the apple allows you to find that pathway to success.
Are constituents a little surprised that you have a bipartisan relationship, that bipartisanship
Not at all.
exists?
I think they know my personality. I think that they know that success has to be achieved by working with individuals who have the same goals. And Representative Nickel has those same goals for his constituents that I do.
And part of my frustration with Congress is you have so many people who want to get things done, who are pragmatic, who want to work together, but that's not newsworthy. Nobody covers a plane that lands on time. They cover the plane crashes, which we got to see in some extent yesterday. But the vast majority of the members that I work with are focused on getting things done, and and unfortunately most people just don't get to see that. And
couple of minutes left. Last question. What's the biggest thing that you worry about in healthcare and combating cancer? One thing that you really wish policymakers got, especially as a doctor?
That we cannot allow the innovation to be stifled. We as legislators need to work together and find that pathway to unleash the investments and the innovation that are truly the cornerstone of American medicine. American patients expect that, and we as legislators have to find that pathway to be able to allow, there are new tests for colon cancer that have been approved and are going to be unleashed, that Americans who are very hesitant to have the screening processes done, the colonoscopies done, can now have a blood test to be able to diagnose early colorectal cancers. It's early diagnosis and treatment that allows for cures, and that's what we will continue to do in the House of Representatives.
And that research part is such a big part of it. My biggest frustration with this issue is we've lost focus on these amazing researchers and the work that's being done to develop the next generation of cures. You get elected to Congress, you get to meet these people who are doing amazing things, and when you start focusing on how we're going to help your grandmother survive, a rare disease, cancer, whatever it is, that really should be the focus. And when we're doing that, we're on much more friendly ground for getting things done and moving legislation through Congress. So that's my biggest frustration, but it's a fixable issue, and we just need to change the focus to that instead.
Well, thank you so much. Please thank the Congressman for joining us this morning. Thank you so much.